Welcome to Sykes Peak, where we talk just about anything that comes to our minds. I'm Dr. Keith Roach,
I'm Sean Van.
and together we are Sykes Peak. Today, our topic is talking about counseling in general, the whats and the whens. And we're going to divide this up into two segments. First segment is going to deal with the types of counselors that you have. And you've got counselors that are from zero, best friend kind of counseling, all the way to a psychiatrist. Welcome, and we're glad that you're with us, and continue on listening. I think this is going to be an interesting aspect because we're going to cover the whole spectrum of the different types of counselors that we can remember while we're sitting here doing this recording.
Yeah. Well, there's so many out there now. I mean, what started with one over time has kind of branched into different fields of study and different applications. Yeah,
Right.
special. It's same with medicine. You know, it used to be there's a village shaman, and now how many specialists do you have insurance for? So
The old witch doctor. Yeah. And
Yeah.
now, you've got
Yeah.
something for everything.
everything.
Well, even in the naturalist medicines,
Yes.
there were different people that believed that different roots did different things,
Yeah.
So it gets more specialized nowadays, and I think that's probably a good thing. But it's difficult on the individual out there that's
Yeah.
looking for a counselor because they just want somebody.
Right.
So my thought is that we start with the start at zero. You're starting with something's bothering you, something's going on in your head that you can't shake it, and you call your best friend.
Yeah.
And
Yeah.
that can be. I mean, that best friend can be a counselor. It depends if on how they deal with it.
Mhm.
And so we're going to talk about how to do that counseling. That best friend, because I think it's important to know that you can't just talk to somebody and fix their problems.
Mhm.
Best thing to do is to listen to somebody, help fix their problems.
I think about it like, and this is my background. I'm a bit of an artist. I dabble, but I remember in high school, my art teacher, she would come around and she would point things out and make comments, give you, tips on, hey, have you thought about adding some extra white in there to even it up, or, try a bigger brush, don't be afraid to take risks. And, those are all wonderful pieces of advice, but can't take the brush out of the artist's hands and do it for them. You can't paint the painting for them. They have
Analogy.
to do their own drawing. So you can't take a pencil out of someone else's hand and do a picture for them. They have to do the drawing themselves.
That's a great analogy. Um, I know that there's a lot of times that when I sat in a counseling session, and I've got, I don't know, somewhere around 24,000 hours of counseling with somebody.
A
So,
lot.
And I know there were a lot of times that I wanted to say, well, here's all you need to do,
Yeah.
but that's that. And I know that the client probably was, looking at me, just tell me what I need to do, and,
Oh yeah.
and I had to fight that urge. I mean, because I had to help them get to the point where they realized this is what you need to do. And even in counseling groups, and I had both men groups and women groups separately. Didn't have mixed couples or mixed groups, anything like that. I did that with premarital couples, but in counseling with men's groups, we had to ask the questions. It was more of a facilitator of the self-help group, what it was. And we had to ask the questions that would put them on a track for them to better understand what was happening in their lives, or what was not happening in their lives.
Sure.
They weren't setting the boundaries. We've had a podcast or two of those. they didn't set limits in their lives, and they felt out of control. So, so
But what would you say to, the novice out, untrained, who has a friend, family member who whose life is just chaos right now? What would you say are maybe some free?
well, we had a model that we
Mhm.
followed called Plicit, PLISIT, I think is what. And uh, P stood for permission, and the LI was limited information. I mean, this is how you gauge the
They want to know they're heading in the right
right,
direction. Yeah.
and then the second point was limited information. Oh, what's happening to me? Chest is tight. I can't breathe. Can't swallow. And then the S, it was SS. I think it was like short term therapy is what it was, and which means that you would go 6 to 8 sessions with somebody that would give them some guidance on how to deal with the problem they're facing. And then the last one was intensive therapy. you know so intensive therapy means that, and this is going to be long term, this is not something that can be handled in a uh, in 6 to 8 sessions. This is something that's going to take some time, and because you have to, the process is, and this is the education part of it. If you're just a friend like you're talking
Mhm.
about, the first thing you do is you listen. um, you listen to their issue. Second thing to do is that you pray with them. Now you're just the friend, just their buddy, um, just somebody that that you may not have known a very long time, but you've developed a close friendship. Um, but that you listen to them, that you pray with them, and then you help them find someone
Can help them further.
that can help them further. And it's, I mean, that's the that way. And I used to tell pastors that, when I would work with churches and stuff, and I was marketing myself, I would go out and I would talk to pastors. I would say, or I'd take them to breakfast or whatever, and I would say, this is what I do, and this is how it can help you.
Right.
And so with pastors, deal on what they were doing, they would meet with a couple, and they would talk to them, listen to their issues, pray with them, and then refer them on. Um, that way, it didn't interrupt their sermon series or what they would say in a sermon, because sometimes they would get up and they would preach about a topic or an issue, and the couple would be sitting in the audience, um, and they would look at each other and say, "He's talking about us in
Right.
front of all
Yeah.
these people. We're never coming back to this church," you know. And so, uh, I would give them the same uh, instruction. Excuse me, the same instruction that would say, you listen to them, you pray with them, and then you make sure that you have a resource that you can send them to.
I think one of when you're talking about listening,
All right.
one of the things that I imagine a lot of people experience when they're listening to their friend, the compulsion, the sensation of, I have to do something to help this person. I don't know what to do. And so they get very intimidated. They just kind of quickly back out of it. They just,
Well, and they don't want to say, "I don't know what to do."
it's hard to say that
I don't know
sometimes,
what
yeah.
to tell you. Yeah,
And so they
because you want to
jump at
maintain your friendship.
they jump at the opportunity then to just offer advice, or jump in to try to fix the problem. Or sometimes they just back, they don't even let the person get the problem out, and
Right.
just be heard sometimes helps more than just, it's not even that I need you to fix this, is that I just need you to hear this whole thing out with me, and then walk away.
And that's tough if
That's
you are
hard. Yeah.
if you're a problem solver,
Yeah.
you got that mentality
Mhm.
of solving someone's problems. Or just solving problems in general.
Mm-hmm.
And someone gives you the first sentence,
Yeah.
and your brain goes off to, "Oh, I know how to solve this problem." So you jump in and start telling them how to solve the problem before you even know what.
And maybe you do, But like you said, they're just jumping in too quick. It's like they didn't even get to their third sentence.
Yeah,
They
right.
didn't get to why it bothers them. They
Right,
didn't get to that.
right.
And then
Or what the real problem
yeah,
is, so
oftentimes, and I do like to the second thing you mentioned was prayer, because it is one of the things that's underestimated about prayer is that it is an action that
right,
you have done something for that person. It isn't just me speaking kindness onto you. It's not me just saying, I hope you have, like it's not sentimental. It's an actual action that is taking place. And that person most of the time will receive it as, well, thank you. Like there's gratitude. There's an understanding of you have their best wishes and intentions in mind with that action.
right, right. And when you're thinking, well, I mean, when you're praying, you're adding the true counselor to the mix.
Yeah.
There are a lot of times I did a lot of praying in sessions
Yeah.
without my client knowing. I'm sitting there listening to a
Yes.
situation. I'm going, okay, God, I have no idea how to handle
Yes.
this, and I get that calming reassurance that says, "It's all right, I got this."
Yeah. Yeah.
And there's a lot of, and then, and that's the Holy Spirit that comes upon you that says, I'm here beside you. I'm going to help you carry this burden, and that's that's the place you want to try to get to, especially if you're dealing with some kind of issue, some kind of problem.
Right.
So, but all right, so talking about um the first part here of the zero level, not and I just use the or base level. We'll say
Right.
that
Yeah. Sure.
base level, not zero, because your friends aren't zero to you, but the base level. All right, so you know the friend says, "Okay, let me help you find somebody that can help you."
Right.
So what are we talking about now on that level in the
Right.
clinical aspect of it?
Well, at the end, right there at the end, you said refer, and then you started talking about pastoral counselors. I think it's also good, probably, to go to the next step up of maybe a counselor that you know or a friend knows. Right? I went here. I know someone who went there.
But if you know them,
No,
isn't
not
that-
not no, 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 not go see the counselor that you're
Oh,
friends
okay.
with, but um, hey, why don't you go talk to our pastor? Right?
Mhm.
Start there.
I see.
Or my cousin went to go talk to this person. I try them. Things like that. Referrals are oftentimes, I would say, by word of mouth, like
Right.
through associations and people that It's through the relationships that we have. But as far as where to get the right kinds of service, I think that's where things get a little tricky, right?
Mhm.
And so um, there are the more medical related mental health sides versus the more maybe relational sides. So, do we want to talk about the degree types, or we want to talk
Well,
about
um, this is where the specialty thing
comes in? Yeah,
because
yeah,
so many times I get requests for referral, and in the explanation they'll say, and they want to talk to a woman, or and they want to talk to a man,
mhm,
and it's you know I get that, I understand that, and I've even made referrals myself.
mhm,
It's I've taken you as far as I can take you, and I believe you need to talk to a woman, and um, and I used to get some kickback on that because
mhm.
I don't want to tell anybody else about my issue, and then I haven't been doing my job because you're still keeping a secret. And I'm not saying that you have to stand on the corner and say, "Hey, everybody, listen up. I had this issue in my life, or I had to, I did this thing, or that's not what
Right.
I'm
Yeah.
saying." But we're talking about when you talk with a counselor. This is one of the most intimate, and I'm going to use this word relationship, and it's not in the sense of intimacy, a sexual
It's not
intimacy, or
romantic. Yeah.
it's not,
Mhm.
but it's a sharing your life, your thoughts, your fears, your
You're being very
anxieties,
vulnerable. Yes.
very vulnerable
Yes.
with another individual. Now, key to that is that individual needs to be educated.
Yes.
There's no doubt.
Mhm,
And
mhm.
so,
So what would a person need to know about a counselor or therapist in the way of like, does it matter if they're a psychologist worker?
um, yeah, I believe so
Okay.
because the training is so vastly different. And I say
True.
this
Yes.
in my classes and stuff, and that is that with social work, they're looking at the environment
Mm-hmm.
that
Mm-hmm.
influences the individual,
Mm-hmm.
social
Mm-hmm.
experience that
Mm-hmm.
that individual. So social work,
Mm-hmm.
that's in the they're looking at the environment. Whereas in psychology, you look more at the root of the situation. So, I mean, it's interesting, and I don't know if you know this or not, but there are some species of trees that are predatory,
Mm.
and what they do is the the reach that they have with their root system, okay, will kill other trees in the within their um, competition area, which
Mm.
is the roots, which is they're vying for the moisture in the ground, and they will reach out and actually kill it. I have this happening in my backyard,
Okay.
and it's interesting, and it's a silver maple. I
Mm.
mean, they're pretty trees. I mean, pretty trees kind of grow and they twist a little bit,
Contort.
and
Yeah.
yeah,
Mm-hmm.
and so, but and the roots will stay on top of the ground.
Mm-hmm.
A lot of them will, and so they're exposed, and so I have another maple tree, a sugar maple um, uh, that's close by, and I'm going to say it's within 25 feet, and this silver maple is predatory, and it will kill the other trees within its
Mm.
reach, and so its reach goes out and reaches
Mm-hmm.
the roots of this other tree and have killed my sugar maple. And so I'm hoping it comes back out in the spring. I don't know, but anyway, the point I'm making is that psychology gets to the roots, and so they go down, whereas social work is looking at the environment. So in
When you
this
say
case,
roots, what do you mean by roots? You mean
roots. I mean,
like
there are
like childhood roots, or are
there
you talking like physical, biological roots?
beliefs. Your personal beliefs. And so psychology gets down to the personal beliefs. Now, they'll ask the questions you know, um, about childhood, how you were
Mhm.
raised. I mean, even to the point of asking, was it a natural birth process? You know, um, and then who your caretaker was. And if your mother was present, or if your father was present, or were they absent, who was your caretaker, and how did they do the caretaking? I mean, those are on intake questions that we go through. Um, but what happens is that it's establishing a belief system that early on, because your sense of trust or mistrust, that's an area, um, um, stage first stage. First 18 months is you're developing a sense of faith
Mhm.
with your trust or mistrust. Now, how do you know? And how's an 18-month-old know trust or mistrust? They know if they're going to be fed or if they're not going to be
Through
fed.
their instincts. It's not
Yes,
conceptualized intellectually, but it is in their instincts
but
and their experiences.
it's something that they know, and even in as early as 10 months, 11 months, they'll start hanging on to things
In
like
my
food. I
yeah,
mean,
yeah,
in general, and
yeah. In my current studying and understanding, so psychology typically takes a scientific methodology analytical approach to what you're saying, where counseling slightly different than psychology as more of a spiritual holistic sort of perception of things, where it focuses less on the let me diagnose as much as get to know you in a relational capacity.
well, see, diagnosis is a whole nother,
Yes.
episode. But
Yeah.
but the
Yeah.
but the but the the deal is that you've got to have that knowledge of the psychology, and psychology is, and the word itself is the study of human behavior, um, and being able to look at uh, a person's behavior,
Hmm.
because that is going to express to you
The inner,
what's going on.
the inner workings, right?
Right.
It's
And,
like the leaves of a tree tell you about the roots,
Right.
Yeah.
and so when you find out that there was something introduced in the roots that was in the environment that was toxic.
I remember kindergarten, first grade, something like that, where you have the rose that's white, and then you put the coloring,
Right.
and then it changes the
Changes the
color
color.
of the blooms.
Right.
And the same sort of principle. If it gets down into you, um, beneficial or toxic, the result could be that it changes
Well,
your
now,
pedaling.
now you understand. It's
Mhm.
like you said. It's down in the base of the stem,
Where you absorb it, yeah.
because that stem is sucking that dye up through and going in through
Right.
the rest of the flower.
Right.
But if you sprayed on top of it, it wouldn't take.
Right.
So it because the leaves on the outside have a protective
Mhm.
moat, and
Right.
you're just the same.
Right.
You
Yep.
you have a protection. You build these walls around you
Mhm.
to protect you, to keep from getting harmed or hurt again.
Sure.
And so, but if you have that issue, that's a toxic issue. It's a traumatic event. It's you know, you were abandoned, as a small child,
Right.
and you think, well, it didn't really bother me. But I'm going to tell you right now, there's a root, there's a toxic part of the root that will make its way into relationships as you become an adult. Same thing for like children of divorce. That's a very, very difficult issue, because when I would do initial interviews with people, intake interviews with people, I would say, are your parents still married? No. Or yes, they are, but they're married to other people. When they divorced? When I was 4 years old. Well, when I would find out that somebody, pre 3 years old, if they got divorced at 1 or 2, there's not as much of an impact as there is 3, 4, 5, 6, 7, and 8. So between 3 and 8, um, that would tell me that there is something there was an abandonment issue. There's some kind of toxic belief that has brought them to the place where they're at today. And then it's just like layer after layer,
Sure.
after layer after layer, because as they age, they find all the ways that they can protect themselves from
Right.
that vulnerability again. And you hear people tell me, I've heard people tell me this, I will never feel that way again. I will never let that happen to me again. And in that process, that
Yeah.
as a counselor, all right, the difference between a counselor and a therapist. Let's talk
Yeah.
about that. What do you
Oh,
see
yeah.
as a difference between a counselor and a therapist?
I think a therapist is so. Let's
First, tell me, counselor. How do you see a counselor? Is it just like what we've been talking about, that friend, just a little bit above being a friend?
Oh yeah, above that.
Yeah.
So to put it into the physical realm, okay, if you have a physical injury that you need to go see a physical therapist for, they're going to do very specific therapies
Mhm.
for that function. However, a counselor is more like maybe like a trainer at the gym, that they're going to be good at giving you exercise and making you stronger, but it's not maybe for quite the same, um, I wouldn't say serious conditions, but it's more relational. It's more steady, ongoing. It's more holistic, where they might branch into various other
This is
areas.
someone that I can count on.
Yes,
Yeah.
right.
All right, let me take your analogy a step
Sure.
further. You go to the
Okay.
gym, and you've got a trainer, and they get you to a point where you've lost 15 pounds or you gain muscle or whatever, and you want to be a bodybuilder. Is that same trainer going to be the one that helps you, or are you going to go
No, you can use
step
another one.
up?
That's fine. Yeah.
Well,
yeah.
and seeing that trainer
Yes.
has to be
Mhm.
knowledgeable enough to know
Yes.
that's not my
Right.
specialty. That's
Right.
not what I do. And that's the same thing for a counselor. If you realize this problem that I have goes much deeper, that counselor needs to have that capability and that knowledge enough about themselves and their abilities to be able to say, you need to go to somebody else. I need to set you up with this therapist.
And it's one of the things I think is very difficult about the profession right now is a lot of the training is talking about that got to be careful letting people go because you've already built that relationship, and so now they have to go and build a new relationship, and so there's also you can't use it as an excuse to be like, well, I don't want to deal with you, so I'm going to say I don't know how to deal with you, right? So there's a lot of guidances and guidelines about how to avoid doing those things, but again, that's where training comes into play and experience, I think, and just the wisdom of knowing I know someone who can help you and I would be doing you a disservice, and communicating that, because there are protections for that as well, like to make sure that you're not exploiting people financially and other things that help them, right?
Well, and there are times that my experience, somebody said, or I looked at a situation and I go, I've taken them as far as I can.
Yes.
As a man,
Yes.
they need to relate to a woman because their issues have to do with relationships with women.
Right.
And
right.
so that's a great place to learn that. Now, in the process, you said, I've got to develop a new relationship with a counselor,
Mhm.
and that process, though, that's where you sign that release, and then your counselor can say, can open up and say anything to the therapist. That way, when you have your first session with the therapist, they have a really, really good idea about what your situation is, and then they can continue
Right.
the therapy.
Well, and two, to make sure to also, I think, communicate, right? Hey, my goal is to get you to this point, and that if you have continued in these other areas, I know some people we can get you connected for those reasons. And then relate it like we were talking with the bodybuilding stuff. It's like, okay, I'm going to be great for giving you a good core and strength and back positions and all that, but then when you want to get to the competitive level, you're going to need somebody different for that. So I think that's important to communicate ongoing with your clients to let them know where you're at.
Well, and it just takes a good counselor. I mean,
True.
a good counselor is not going to, continue with this piece of doubt,
Right.
in the client's mind, and a client gets comfortable with it. And that happens, and they even get to the point where they have this transference, and that's a Freudian term, where they begin to get emotionally involved with you. Before I get to that, but I want to ask a question.
Yeah.
Is there a difference in the education of a counselor that we're talking about and a therapist, which would be that specialty or next level? Is there a difference in their education? Also,
A lot of it, I think, comes down to the letters after their name,
Mhm.
credentials, trainings, special trainings that they've had in particular technique.
Mhm.
So when we're talking about, um, university graduates, 60 different counselors. Some are going to go into specialties that work with children.
Mhm.
So a lot of their training and techniques are going to be aimed and engineered and geared towards working with that population. Others might be dealing with people with substance use, or like you said, like traumas and grief, things like that, marriage and family relationships.
real popular ones, post-traumatic stress.
Yes. Right. So then you've got these specialized trainings, things like EMDR, play therapy, just different things that are going to be more
Art
specialized.
therapy,
Art
yeah,
therapy, right?
music
Music
therapy.
therapy,
I like the music therapy.
role playing and drama. But you know, it's
I couldn't do that. I had a hard time.
with drama. You have a hard time with drama.
No, no drama, but with role playing.
Oh,
You
yeah.
know, I mean, that's a technique that you use in therapy, but
But I also think there's a certain degree where the counselor or therapist would be almost kind of drawn to it. Like they can probably
well,
do it naturally
well,
to some degree already.
what I would do is I would change the role. I would say, okay, I'm going to be the client, you be the therapist,
Right.
and I'm going to tell you what the problem is. And what I would do is I would just echo what they had told
They
me,
say.
and then I would have them tell me what they think I should do. You know,
Good
which
technique.
yeah, which you know, it's coming out of their own mouth that
Yeah.
you know, here's what you should do. You
Right.
know, and that worked sometimes. You know,
yeah.
but I mean, you know, that's the thing is that experience
Right.
tells you when to use role play,
Mhm.
when to use, you know, play therapy. I mean, I worked mostly with kids, and I had a toy box in my office, and it was full of toys. And I wish I had the toys because there was, you know, Ghostbuster stuff in there. There were Transformers, and I had a Barbie house. I mean, I had all the toys that kids liked and stuff, but you know, I would know when to pull those toys out and when to just, you know, let's just me and you and talk, you know, and I would sit in the floor with them. I mean, you know, I mean, that's the type of therapist that you're looking for is that, you know, I mean, there were times that my clients, came into my office one time and my client was supposed to be waiting, you know, and I had a couch, you know, just it was more of comfort than it was, you know, a Freudian thing.
Right.
But and so I came in and I looked and she wasn't sitting on the couch and you know, I had a comfortable chair in my office. I mean, you know, and I'm looking around my office. I mean, you know, it's not a big office. I'm looking around my office. And I'm like, where'd she go? I mean, you know, and she was under my desk, you know, and so we did the session. Me, you know, pushed my chair back and I just sat on the floor and talked to her while she was under my desk. I know, and I know people are like, under her desk, that was crazy. Well, you know, she was she was on the break, on the precipice of making a change, of getting to
Scary.
feeling whole.
Scary.
I mean, whole again, and that was a breakpoint session. And because when I sat there and we talked, she told me what was the most vulnerable thought that she had, that she'd been holding back for, you know, months. And we got to that point. She told me what the thought was, and I gave her I gave her guidance and direction on what it was that was happening to her. And I, you know, it made a difference in her life. And you know, I'm not outing that I
Sure,
made
yeah.
a difference in her life. No. When
That
she
made a difference in her
yeah,
life.
when she did the behavior, that made the difference in her life. You know, because she trusted.
Uh-huh.
Here's the thing: she trusted a man.
Yeah.
And
Yeah.
in that process, and she got better.
So
you know,
you've said trust several times in our discussion today. Do you think that that's the central point for how to know that you can work with a counselor or a therapist?
well, we've used the word vulnerability
That
and
too.
being vulnerable,
That's the client's responsibility, is being vulnerable.
and see. Well, I mean, you know, that's a root problem.
Well,
That's what I'm talking about with psychology,
Mhm.
is that it's a root problem. If trust is not available to an individual, now it's there. It's just that you're making a decision as to whether or not you're going to do it or not.
Sure. So if I've been through some things in life and I've had some traumas and I'm talking to my friend because some things are resurfacing due to recent experiences, my friend, they listen, they pray, and then they give me a referral somewhere. And I'm walking into that therapist or counselor's office. How do I know that I can trust this?
Well, you don't. I mean,
Okay.
just the profession itself says
Mhm.
anything that you say to me is in confidence. Um,
So then what sort of things should I look for walking into that office?
education.
Okay.
That's my first thing. You don't. I mean, you can't hold yourself out to
Mhm.
be a therapist unless you have at least a therapist on your own.
Mhm.
They call it putting out a shingle.
Mhm. Mhm.
A therapist on your own
Mhm.
without having a master's degree. And there are some counselors that do have bachelor's degrees,
Mhm.
and you can do drug and alcohol counseling with a
Mhm.
bachelor's degree.
Do they
Um,
need to be licensed?
well, I believe so. I mean, um, I had my license in Florida, and uh, and that was a challenge to get, and there's no doubt. But yes, you need to be licensed.
It
Um,
helps.
well, what it does is it says you met all the um, criteria to that is uniform across the board for
Mm.
counselors and
So
therapists
someone is
in the
basically
state.
someone certifying you know what you're doing.
Right.
It's not just you saying, I know
I
what
know
I'm
what I'm
doing.
doing. Yeah,
Yeah.
yeah,
Yeah.
yeah. And uh, it is somebody that has acknowledged that you have the education that's associated with being
And skills and
right.
right.
Right, and you've had supervision. That's the see. There's, I mean, I don't know the hours anymore. What are the
Oh,
hours that you have to have?
3,000.
3,000. So it
It's
hadn't
a
changed.
lot.
Yeah, it hadn't changed.
And
3,000
and they're
hours.
in different things. So, you've got a little bit of this, a little bit of that. So they're most counselors are pretty well versed.
But you have to have supervision along with those
Yes.
3,000 hours.
Yeah.
So you're being supervised by somebody that is
Mhm.
licensed. So
Sometimes
uh,
multiple people. Yeah.
right, and so it is. That lets you know when you walk into the office that the individual that you're going to speak with has met the criteria to be considered a counselor. Now, along with that, there are assumptions that you make. What I say to you in confidence. Same thing if you were an attorney
Mhm. Yeah.
or
Right.
a pastor.
Right.
Now, see, my deal was um, I was ordained as a minister, so anything anybody said to me, was in confidence. So if they were, if they were in some kind of legal issue or some kind of legal trouble, anything they said to me was like a confession to a priest, and so it was covered. So, and I used that a couple of times uh, in some lawsuits and things like that that I had to ended up being a part of. But I would just say, well, that's a pastor, parishioner confidentiality. I can't reveal that, and they would say, well, I thought you were a counselor. Well, I am that too. Well, in this situation, they waived as a counselor. I said, yeah, but they didn't waive as a pastor. And because it was not, I considered it not to be um, pertaining to the problem. What they were trying to do is they were trying to discredit the individual. And so, anyway, the confidentiality is a
Big part.
extremely important
Big
part.
part of that.
Yeah.
We can talk a little bit more about the process too in our next episode about what it's going to be like going through the process. But I think, again, the counselor themselves, do their techniques matter? I mean, we've talked that they need to have an education.
Mhm.
It's better if they have a license. May not be 100% necessary in every case, but you're looking
Yeah.
for someone who's credentialed and knows what they're doing.
The interesting thing is that it used to depend on um, the college or the university that you went to,
Mhm.
because that university
yeah.
was usually they would have their main psychologist that
Mhm.
was that had his own theory
they teach and train a certain style.
Right. So, if you went to University of Chicago, it was Carl Rogers.
Right.
If you went to Harvard, it was behaviorist. And
Right.
I mean, so it was, it used to depend on that.
So it's like artists who would study under a master would have either impressionistic style or
Right.
Okay.
Right.
So
So it would depend on and seeing their, I mean, you can get in. Well, I mean, we can get into all the history and systems and the theories and all that kind of stuff. But everybody thinks when you walk into an office, everybody thinks you're Freud or you're trying to be Freud.
Yeah.
Yeah. But
yeah.
I was what I refer, and I would tell clients I'm eclectic in my approach.
Mhm.
And what that means is that I use a little bit from all the different theories that I'm versed in. And,
Would it be worth asking a counselor their theories or what techniques they use?
what I would think what your beliefs are.
Mhm.
I mean, that would be the first thing that I would say. What are your beliefs? And, and I was very open and honest, but of course I put it out on my shingle.
Advertising.
Yes, my advertising was that I'm doing Christian counseling.
Part of your title.
I even worked at a place called the Christian Counseling Center,
You're right.
and people would, they would ask me, just different situations, and I would say, you do realize that this is a Christian counseling center
Mhm.
because this is how I'm going to counsel you, but that's that, what's your belief system, I mean, because like I said, an individual's issues or their problems go back to their belief system.
Right.
And it's not necessarily that you have to have somebody that has your same belief system doing the counseling. I don't know that you would want that. You want somebody that is solid in their belief system, but you need to know if they're out on a limb
Mhm.
and not close to the trunk, if you understand what I mean.
Mhm.
I mean, we use a lot of analogies in this, but the trunk is, psychology, and out on the limb is crystal psychology.
Mhm.
Just carry this crystal with you when you leave today, and this will change. No. We don't use trinkets.
Right.
You stay closer to the, to the trunk. You stay closer to the solid. It doesn't mean that you don't, you may have Adlerian approach to things, but
Meh.
I mean, the client doesn't really,
Right.
they don't really need to know that. If they want to know that, you can say, here's a good book to help you to understand. And you can give them something that they can read and they can go, oh, I get it. No, I see what you're doing now,
So then I'm going to ask you this because I think you probably have a little bit more experience. When do you think that medication would be necessary?
Well, we're moving to the next level now, because you go from therapist, because the therapist may look at it and go, well, you have some issues that are associated with medical problems. And you might say, I'm going to refer you to psychologists. That's the next level. And psychologists might be therapists. And a psychologist is a doctoral level individual, which means they've done extensive training and education beyond the master's degree, which is usually about 2 years, 3 years to get a master's degree. But a doctorate degree is, another 3 to 5 years.
Mhm.
And that means part of your education has been in a hospital setting. And so you have some idea of what's going on in a hospital setting.
Mhm.
Then there's the next level, which is the psychiatrist.
Mhm.
Psychiatrist has a medical degree plus 8 years in psychiatry.
Mhm.
So so it's a
Mental health medical combination.
yes, and so it is it's medical in the mental health,
Right.
and
So there's APRNs who are also like nurses who are then get especially trained with mental health, to just be able to do that as a focus,
Right.
right? Kind of like nurses
See,
can
we're,
specialize in other things
and,
too.
and that's I get it in the
Mhm,
medical profession,
mhm,
because the doctors are few and far between. There's a lot of
mhm,
people. I mean, there are doctors that just are not going in that direction, especially in rural areas.
mhm.
Um,
Now, there's some conditions, for instance, like I would say more severe conditions
mhm.
that you definitely probably need to make sure to see an expert for. And some is like, I'm definitely dealing with anxiety. We know we're dealing with anxiety. Can't I just go get some anxiety meds and that be beneficial to me?
Well, absolutely, you could do that.
Mhm.
The thing of it is as a therapist, I want to discover what's causing the anxiety.
Mhm.
I mean, now I used to ask a question of clients that would help me to determine if this is an emotional problem or if this is a medical problem. And it was a question I would do. I would ask the question, if you had a magic wand,
Right, right, right.
you
Yeah,
know, and if would depend on what their answer
yeah.
was. If they would
What would
say,
make your life perfect right now, right?
right, and I
Yeah,
would say, what would you do? And they would
right.
say, oh, I would change my world, change things in my environment, you know,
Mhm.
um, which would tell me that was more emotional. And if they would say I would change me, that would tell me it was more medical.
Mm. Mm.
And so yeah, that was a layman's,
Sure.
I mean,
Right, 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 right.
area when
Right.
it came to
We might have to
medical.
explore a little bit further, but yeah,
Right. And that was an initial question. There were
yeah. It puts you in
50 other questions
kind of
after
sends you in
that,
a direction, left field or right field.
Right. And so we would have a basic understanding of what they were going through. And as we would have the basic understanding of what they were going through, then we would step back and I would say, um, you know, I'm going to suggest that you go see your medical doctor and
Yes.
explain to them these
There's
are the
been
symptoms that you're having.
So there were a few times I actually would also refer and tell them, you might want to get a hormone test done or a sleep
Boy,
study done or a you
I
know
I laugh at I chuckle at the hormone. I mentioned one time to a psychiatrist about a hormonal state, and the psychiatrist said, no, their psychiatric state and their hormonal state have nothing to do with each other. And I thought, I'm going to have to find another psychiatrist,
yeah
because
yeah yeah yeah
that is not my experience,
right
and so, um, it's so, when do you go see a psychiatrist? That's when you need the medication. And a psychologist, they cannot prescribe medication.
right right.
And people go, no, I'm not crazy. I don't need to see a psychiatrist. And that's
That's not
not
what it's
what it,
about,
yeah,
right?
it's not what it's about. I mean,
Right.
psychiatry is about a medical doctor that has a deeper understanding of what's going on inside your
Yes.
brain.
And it's important too to also make sure to have ongoing visits, check in to see how the medications are working or not.
Right. I'm going to say this, um, the osteopathic approach, and DOs is what they call them, Doctor of Osteopathic Medicine. Um, they they are not looking at um, big pharma
Right.
type medicines.
Right.
They're looking at things that could affect why you have anxiety or could affect, and you'll see these, and I see these popping up on TikToks and things. There's one in particular, guy named Gary Brecka,
Mm.
and he does a DNA test,
Mm.
and it looks at 5 different genes in your system. And then what he does is uh, if, if those genes
Mm.
are creating problems for you, then it's because of the minerals and um, the things that are not present in your body.
Mm.
And it's basic things like boron and
Mm.
silica, and I mean, just some basic um, magnesium,
Right. Yes.
potassium, those kinds of things. And of course, he sells a multivitamin that goes along with it.
Right.
But the reason that he is popular is because, and that sort of thing is popular, is because science has changed.
Yes.
I mean,
That's important to consider too. As time changes, you know, are people keeping up with their understanding of new science coming out and new data? And so,
see, the old system, I guess,
mm,
is what I would call it. What they would do is they would look at your family history,
mhm,
and they would say, and you'd say in your family history, you had a mother that experienced depression all the time, um, and you had a father that, um, you know, always was trying risky things. I mean, so you've got the makeup of a manic depressive or a bipolar, situation. But how do I deal with bipolar? I mean, and the old system was medication, and they had specific medications that would try to stabilize neurotransmitters in your brain. And because they knew these medications acted on those neural, well, that's what I mean, that's what medications do today.
mhm,
You have, um, the reuptake inhibitors and
mhm.
all kinds of things like that, and they're very helpful to people, for a period of time. And then the dosage has to change, or the medication has to change, and it's just how people, how their bodies relate to different things. So there's a whole lot of uh, behind all the
Mhm,
psychiatric
mhm.
aspect of it. But psychiatrist um, handles the intensive therapy that I was mentioning back at the beginning,
Yes.
and and um, you know, a lot of times psychiatrists, you go in to see a psychiatrist, you only get 10 minutes with them, and because it's a med check, the psychologist you'll spend an hour, and that's
Really,
not
again, being
cheap.
vulnerable, talking,
Right.
getting it out.
Right.
Yeah.
Well, getting to the
To the
root,
root.
and that's the key, because when you get to the root and you find out what the root problem is, then you can start making the changes to, um, you know, to the toxicity and you recognize, and you start realizing, I don't set boundaries in my life for anything. um I just let my mind, go off wheeling neely
Right.
and just do whatever,
Mhm.
I can't shut it down. Well, I mean, there are some ways to learn to shut it down, and part of that is talking to somebody, you know
Do you think that if a person was recommended to go to spend time at a hospital, that that is something they should be worried about or concerned about, or is that? I mean, I know personally,
not to be
it's
afraid
pretty
of. No,
rare.
I would say don't be afraid of that. I mean, and usually we people are hospitalized because it's a pretty severe issue,
Mhm.
you know
So I think there's a lot of bad blood between mental health hospitals in our culture, just historically, just because of some ancient practices, we'll
Mhm.
call them that aren't done anymore. But I think there's some distrust, and so what would you advise to a person who was being told that may need to look at a hospitalization type of event?
I would take advantage of it.
Yeah.
I mean, of course, insurances are a big part of it today.
Yeah.
You want to make sure that your insurance covers the
Mhm,
process. But but usually, I mean, if you have a psychiatrist that says, you need some time in the hospital, I think it's important. Now, why do you go to the hospital? I mean, what what's the criteria that would put you in the hospital? Would be things like hallucinations, out of control hallucinations. Uh, and what I mean by that is that you're seeing things everywhere you go, uh, and it begins to control your life.
mhm,
Um, Delusions,
mhm,
where you think you're something else or
mhm,
somebody else. Um, then suicidal ideation. If you're thinking about harming yourself or killing yourself.
mhm.
Um, um,
Paranoia.
paranoia.
in
Well, see,
extreme levels.
see, all these things, all these symptoms are usually associated with um, a very specific diagnosis. And when you meet 4 out of 5,
Right.
5 out of 6, 8 out of 10, then a psychiatrist is going to say you need to have
Yes. And I
hospitalization.
think it's like, you had a bit of a cough, you can just go to a clinic and go check in with your doctor. If you were coughing blood, you
Mhm.
might want to go hospital,
Right,
right? Yeah,
right. You
so
go to the next
obviously,
level.
when your conditions have gotten to a certain point, that's when you might want to.
Well, it can be, depression. The things that I'm
Yes.
mentioning are,
Yeah.
are usually a personality disorder of some kind. But what I'm talking about now is just, if you have depression and you cannot get out of the depression, and it's more than the doldrums. It is, where you're just dragging, and every day is just can't go and be around people or talk to people or
Mhm.
you can't get out of the dark. You keep the
Yes.
light down.
Curtains closed, all that. Yeah.
Right. And then it's probably best that you seek
Right.
out some help, and then the other part, anxiety, you can't leave your house. You can't go to your mailbox. You can't,
Without getting
those
sick
are,
or something. Yeah.
those
Yeah.
are extreme levels of anxiety. And there's a way to get help for those things.
Yeah.
So it's, and we have, I think of the bionic man, we have the ability. We have the medications that can
Right.
help you, and as you get those medications, they can make a difference in your life.
Okay.
So
I have one other question, maybe something for us to talk about real briefly. But before that, I want to make sure to let all of our listeners know another resource they can always reach out to. They can call 988. That is a crisis hotline. That is for anyone for any crisis at any point. So it's not just how there used to be the suicide prevention hotline. It's not just for those. It's also if you feel like you or someone you know is having a panic attack and you're in a moment of crisis, you can call that number and they can help you over the phone. One thought I did have, maybe just briefly to kind of talk about, is um, in all of this, I think at the beginning, to kind of tie it all back, at the beginning, we were talking about how the client, the person who's not the therapist, not the counselor, but we'll call it client, is the person who is holding the pencil doing art. Is it the therapist or counselor's job to fix me if I'm having a problem, or do I?
that's a great question because there is the the tug on every counselor when they hear an individual's situation to say, "Oh, that's easy to fix." In your mind, you're sitting there and you go, "That's easy to take care of. I can take care of that. I can fix that. All you need to do is, but a therapist is going to guide you to help you make the decisions to fix the problem because, like I said earlier, then it's on you. You don't do those things. If you don't set those limits, if you don't set those boundaries, if you don't,
Well, I give you the pills, but you don't take them, right? I
Right.
teach you the techniques, but you don't use them.
well, and a lot of times, the pill issue, a lot of times people will take it and they go, "Well, I feel better."
Oh yeah. Or I don't feel
And
bad
stop
today, so
taking
why
it.
take it? Right.
And that's not how it works. Attention deficit disorder medicine, um, it's the same way. You can't just give the medicine during the week and not on the weekends.
Right.
You give it because the medication is helping the individual all the time. And what it does in its action on the brain um, helps the individual be able to participate in their world rather than just operating outside their world,
I
because
always
their
explain
brain takes off.
I always explain it like it actually puts them in the driver's seat of their car rather than the passenger seat of their car.
Right.
So the car is going regardless. It's out of control because they're not in the driver's seat. Once you give them their medication, they're now in the driver's seat and they can start to learn how to drive their car.
Which makes it all the more important to, it's not like an antibiotic.
Right.
You take 7 to 10 days, and the infection's gone.
So if a person's going to get help and they don't feel like they're getting help and change isn't happening, is it that they're not doing enough, or is it that their therapist isn't doing enough?
Um, I would say that it's probably a little bit of both, because
Yeah.
the therapist has to realize if they're making progress or if they're not, because the goal of therapy is to get you out of therapy. You know, I used to tell my students, I'll never be out of a job. Well, I stopped doing therapy, and so and
You got out of the job.
get out
You
of the
didn't
job.
put yourself out of a job.
Yeah, and but that's how it is. People always have problems, and they'll always
Sure.
have issues, and they always need somebody to give them guidance and direction.
Right.
But it's it's a point where um, understanding who you are, what you need to do, and what path. Because you go to a counselor and you're expecting them to fix the problem, but if you're not applying things that you talk
Mhm.
about
Right.
in the therapy session,
Yeah.
the problem is not going to get fixed. How do you fix the toxic um, root? It goes back to when you were 18 months old. Well, as an adult, you can look back, or you can look at the situation and say, I know how that root affects my behavior today. And so I'm not going to choose that way to respond to this issue, um, because I know better. And so it's um, it's you being the artist. I mean, the individual being the artist. The counselor, therapist, psychologist, psychiatrist, they're the ones that uh, are saying things like more more white, more shadow, more,
Yeah.
and you have to figure out where to put it. And they'll give you guidance on where to put it, but you have to make
Gotta
you
be
have
the
to
one
make the
putting it.
decision.
Yeah.
Yeah, you have to be the one. And because if you're not doing it, um, can't blame it all on the therapist, unless the therapist is like, you know, very authoritative and dictatorial in their approach. Here's what you need to do.
Right.
And so it's it's you need to find that therapist that, and you don't want the therapist that's sitting back and going, how did that make you feel? I mean, those are
The
of
classic
course, yeah,
questions.
those
Yeah,
are the
yeah, yeah.
classic
Yeah.
psychologist questions, but because they need to know what your feelings were. But if they're not, if they don't seem like they're engaged, now there's a theory, or a type of therapy um, that does that. It just reflects back what you just said to them.
Yeah.
And there are times that I've used that, and people have looked at me and go, exactly. That's
Yeah.
exactly what the problem is. And I go, well, that's what you told me.
Yeah. Yeah.
Now you got to tell yourself. Now you've
Yeah.
heard it.
Yeah.
Now what do you do about it?
Right,
And
right.
so, and sometimes that's what a therapist does, is just listen and reflect back what you've talked about. So, you have some questions. Connor Jackson is our producer, and he's been writing fervently on his pad. Do you have? Oh, he's taking notes. Okay. Right. The question: when is it better to go to a counselor or a therapist? Um, I believe that you go to a therapist with the understanding that it's going to take some time to fix this problem.
Right.
A counselor is one that can help you in the initial part of it, but a therapist is going to take it to the next level, and you realize that it's going to take 6 to 8 sessions, or it may take 6 to 8 months. There have been times that I got through the problem in 2 sessions, but it took months after the
Make the
first two
change.
sessions, two first sessions, to fix that toxic part of the, so
Mhm.
That was,
Plants grow slow.
yeah.
Yeah. Well, and two, the further back, sometimes the harder it is to get it to really and see all of the areas that it's taken over in your life.
Right.
And I think too, maybe more specifically, like if you've suffered early childhood events, um, abuses, traumas that have occurred in your life, those might be also good times to think of therapists, or maybe more recent, just a series of unfortunate events have been occurring, might be more counselor oriented.
Right.
Relational might be more counselor oriented.
Yeah. Where you look at it and go, I just have bad luck. Yeah. And that's,
Man, 2013, lost my job, serious breakup, like it was just one thing after another. It
Yeah.
felt like Job. It was just
Yeah.
like, okay, what next? Right. Like that might be a good time to go to a counselor because it's in the more of my situation now, dealing with something from my childhood, um, heavy traumas or abuse, then that might be something to go see a therapist for. Um, any other specific examples you can think of? Severe depression, again, can't leave the house, boarding up your windows with your curtains and just
Yeah.
living in the dark all the time. More serious versus, I get a little blue,
or, when you start closing off the light
That's
in your
that's
house
that's
because
so
you think you're being bombarded by, and this is where the delusions come. I'm being bombarded by microwaves that are changing my brain, and so that creates that. Boy, I mean, those kinds of things probably would be good to, well, not probably, it would be good to go and see a psychiatrist. And I've got this happening.
this would be, I think a lot of this is probably going to come up in our next episode too, about when do I need help and how do I know I need help. And so we can get a little bit more into that. And also maybe more of what to expect in the counseling process. So,
This would be a good place to stop.
yeah.
Thank you for listening with us today. I'm Dr. Keith Roach,
I am Sean Van.
and we hope that you gathered some information about what it is that counseling is about and what types of counselors there are out there. We hope that you will listen to our next segment about when to go to counseling. That one's coming up in a short period of time, so just be listening. Thank you again.